All right. So I think we are live. Hello everyone. Welcome to this session where we'll be discussing the high-yield topics for the NEET SS medical group entrance examinations. So I'm Dr. Rahul Rajeev, and with me I've got Dr. Karthik, Endocrinology faculty at DocTutorials. So together we'll be discussing today on the high-yield topics for the NEET SS medical group examination. Now, at the outset, let me tell you that we have made a system-wise collection of important topics. So what is it based on? Number one, the topics that have been stressed upon in the last few years of the NEET SS examination. And also we have included some probable areas as well. So we'll tell you that these are must-do topics. We all know that medicine is as vast or maybe even more vast than an ocean. So nobody can complete the entirety of syllabus. However, exams, especially such competitive MCQ exams, it's all about probability. What are the topics that you should look? And in the remaining few months for the examination, what are the topics where you have to put maximum focus on? That is what we'll be discussing today. And let me also tell you that in the WhatsApp group of DocTutorials, I hope the listeners, you all are there in the Target NEET SS. That's the name of the WhatsApp group of DocTutorials, where we have got all the faculties training you for the SS examination. If you are not there in the WhatsApp group, you can just send me an inbox in the Instagram. My Instagram ID is dr_Rahul_Rajeev. Okay, so you can send me an inbox and I shall be, giving you the link of the Target NEET SS group, because we'll be sharing the PDF of this session in that group as well. The system-wise collection of the must-know topics for NEET SS. And Dr. Karthik has made this with so much of effort, because you know that going through all these questions and arranging them system wise. So he has taken this pain for you, and he'll be doing the presentation as well, and he'll be coming up with an analysis as well on what are the topics that you should be focusing upon. I think let's not waste much time, because time is so crucial at this point. So let's start this session. Karthik, welcome. And I think we'll start with the analysis part system-wise on the high-yield topics for NEET SS. Right. So Avinash in the comment section says that Karthik, you're teaching so nice. That is, great to know. Karthik is a wonderful teacher for endocrinology. And I think during his time, he was ranked 2, if I'm not mistaken, Karthik, for the NEET SS entrance examination, All India rank 2. So yeah, so we'll be discussing a bit on this strategy as well, but we'll first start with the high-yield topics, and then, we'll move on to the strategy first. And over to you, Karthik, and yeah.
Thank you, Rahul sir, for setting up the stage so nicely. So as Rahul sir has emphasized, so the today's session aim, I'm straight away putting a disclaimer that we are not claiming that all the questions that are going to come for the exam will be straight all from these topics. It is virtually impossible for anyone to guess what all areas the questions are likely to be from. I'll just give an example. So even if you ask your cardiology faculty, like which all areas to study prior to the exam, he would not have guessed cardiac sarcoidosis. But last NEET SS 2023, there were 2 questions from cardiac sarcoidosis. So those things are bound to happen. So what we have done is that we have collected all the medicine questions in the last 2 NEET SS 2022 and 2023, and as well as the INI medicine papers from 2022 to 2024. That would be another 4 to 5 sessions. So we have compiled all the questions and we have analyzed the pattern, which are the areas which are more frequently being asked in the medicine paper, and we had made a specialty-wise list of those questions. And we believe that any student, before going in to the exam hall, should have a taste of these questions, at least these areas. They should revise focusing on these areas. I'm just telling focusing. You have to go by your own revision, but to lay specific emphasis on these areas. You already have the materials with you, all the Q bank, the notes that you have prepared, the Harrison videos, the Elite test series videos. So all the resources are with you. So make best use of the resources that you have at your disposal with special emphasis on these areas. So here in this short session, we will be discussing on the specialty-wise distribution of questions that were asked in the 2022 and 23 sessions, then laying emphasis on the high-yield areas from each specialty, and finally, what is the expected difficulty of questions based on the exams that we have had in the last few sessions. Okay. So when you look at the NEET SS paper, you have 150 questions from the general medicine pool, largely based on Harrison's medicine. And this was how the distribution was like. There is no significant variation from the distribution of questions across specialities. The top contributors were neurology and gastroenterology, as well as endocrine, ranking the top three. But you never know because there is so much of overlap between these questions. A question from infective endocarditis could be considered under cardiology as well as ID. So, and a question on empagliflozin on heart failure could come under endocrinology as well as cardiology. So that much overlap is there. But if you look at this in general, all the top major specialties, the neuro, the gastro, the endocrine, the hemat, the ID, cardio, nephro, all would contribute around 15 to 20 questions. So there is nothing to choose between these specialties. So the only one surprise which had come in the 2022 paper was there were a lot of genetics questions. There were around 8 genetics-based questions based on inheritance pattern, questions based on the syndromic features, on rare pediatric conditions. Such questions were slightly more in the 2022 paper compared to 2023. But however, you cannot predict how it is going to be in the coming sessions. So we will start with my specialty, endocrinology. When you look at endocrine, the major areas that comes to our mind are the adrenal, pituitary, thyroid, diabetes, etc. But contrary to our thought process, the most important questions which comes in endocrinology for both NEET as well as INI comes from the bone mineral metabolism. This has been the pattern for so many years. So you cannot afford to miss out reading about the drugs in osteoporosis, the evaluation in osteoporosis, and hypercalcemia. Even in the last paper, there were 2 questions regarding hypercalcemia, which are the causes of BTH dependent, independent hypercalcemia, its management, bone mineral disorders in CKD. All these are very, very hot topics in endocrinology. Coming to diabetes. So if you ask me which is the single most area in diabetes, it would be the oral anti-diabetic drugs with special attributes. So we have discussed in QRP, which is the OAD that caused this, which is the OAD beneficial in heart failure, which is the OAD beneficial in CKD, which is the OAD that can cause worsening of heart failure, weight gain, osteoporosis. So all these conditions where you will be given a clinical scenario and you'll be asking which OAD is preferred, which OAD is least preferred. Such questions definitely you can expect. The newer drugs, we had a lot of discussion in the QRPs, the newer QRP that has been released, and also in the group, we have been discussing about the newer medication. Then about insulins, the short-acting insulin, long-acting insulin, ultra-long insulin, the newer insulins, all these are also important areas. And pituitary, so even though you have a lot of areas like the acromegaly, prolactin disorders, but the one area where a lot of questions have come from both NEET as well as INI is diabetes insipidus. You'll be given a clinical scenario, you'll be asked whether it is a primary polydipsia or a central DI or a nephrogenic DI. So we have learned how to differentiate in our video modules. So please go through that. Now, regarding obesity and lipid metabolism, very, very important area. The drugs approved, the FDA approved drugs as well as dosages. For example, the last year, the question was regarding liraglutide. The standard diabetic dose is 1.8, whereas for obesity is 3 milligram. Semaglutide, the diabetic dose is 1 to 1.5, whereas for obesity, it is 2.4. So such nuances in dosage and which are the drugs approved, you must know. And from physiology point of view, which are the orexigenic and anorexigenic areas, the neuropeptide Y, the peptide YY, all these things we have to know. Then you have to learn that table in Harrison describing the various disorders that comes under uh, inherited lipid metabolism disorders, the types of xanthomas, which I have shared in the group as well, and also which are the approved drugs for the metabolic dysfunction associated steatotic liver disease. Then regarding adrenal, there is nothing fancy about it, just the routine points. Usually the questions are not asked in so much depth in the adrenal, only the clinical scenario with diagnosis, AI, aldosteronism, which is usually straightforward questions. And of course, in the miscellaneous part, you have to know about SIADH. SIADH is a sure short question. Okay, it may come under nephrology or under endocrinology. Then, of course, Men's syndrome and APS. So these are all straightforward theory questions. You have a lot of facts to be memorized under Men's syndrome and APS, and there has been so many questions in the yesteryears in these topics as well. So pediatric endocrinology is usually not much asked in the NEET SS, but last year, two questions had come. One from Kallmann syndrome, another an unrelated hypogonadotropic hypogonadism question. So just a small area is dedicated in Harrison for pediatric endocrinology. That much is enough for your NEET SS preparation. What is hypo? How do you identify it based on the biochemical profile? What is Kallmann? How do you differentiate it from Klinefelter? All these we have discussed many times in the QRP as well as in the Elite series. And I would say thyroid would be the least important part. And if at all it is asked, it is a straightforward NEET PG level question. The only probably slightly difficult question that can be asked is the case of thyrotoxicosis. You would be asked to identify whether it is a Graves' disease or subacute thyroiditis based on the clues provided. So usually the pattern in endocrinology is that it doesn't come under very difficult category. It is easy to moderate are the usual level of questions that come under endocrinology. So if all the new drugs they may ask, but you have to be well versed in that, which we have discussed. Rahul sir, any comments you have to make regarding endocrinology? Any other area you feel that has to be focused on?
Nothing, sir. I think you have beautifully covered it. Yeah, I think we can move to the next one.
So it is your fortes are neurology. Anyway, I'll be giving a small introduction and the stage will be yours after that. So if I am asked to we can choose one area in neurology where maximum questions come from. It is the drugs related to neurology. Even in the last paper, there were two questions regarding the adverse effects of anti-epileptic drugs. If you look at the entire neurology paper last year, there were at least 5 to 6 questions related to drugs in neurology. And in the 2022 paper as well, there were two questions related to drugs. And in all the INI neuro as well as the medical papers, there will definitely be at least two questions from drugs related to neurology. So the anti-epileptic drugs used in migraine, the newer medications, drugs in multiple sclerosis, and the drugs contraindicated in myasthenia gravis. These are the four most important areas where you cannot afford to miss even a single point. There is a beautiful table in Harrison regarding the anti-epileptic drugs, their adverse effects, and which are the types of seizures that they are useful for. So you should not miss even a single point from that table. Then, of course, a few points regarding the neurophysiology and neuroanatomy could be asked. And the questions which were asked previously was related to substance P, the pain pathway, the first order neuron, the second order neurons of pain pathway and all, which were the cells in CNS. It's a very pretty basic question and also related to the role of CGRP in migraine. So these were the questions asked in neurophysiology in the last 2 to 3 sessions. And regarding seizures, so in neurology, the pattern that I've observed is that you have a lot of conditions under neurology. Under primary headache disorders, we have so many headache subtypes. Under element disorders, we have so many disorders. Under myopathies, we have so many. So the usual pattern comes like this. They will give you a clinical scenario based on the history, a few points regarding any relevant biochemical examination, and the NCV or EMG, whichever is applicable. So based on the history and the details provided, you would be asked to make the diagnosis. So whenever you are like dealing with a specific condition, you try to frame in your mind how will they ask a question with answer as this. this condition. Like all that key points you have to know. For example, in a patient with motor neuron disease, you have to be thorough with those keywords. Like the patient may be mostly asymptomatic, it will be element type weakness, they will be having fasciculations, they may having bulbar palsy. So all those keywords you should be able to identify. Likewise, in myotonic dystrophy, that specific facies, the features of myotonia and its associations with diabetes, those keywords you should keep in your mind. And the dementia and movement disorders, the Parkinson plus syndrome. So many conditions are there. What are the hallmark features? And from the clinical history, how we are making the diagnosis, that's been a very favorite questions for the examiners putting up the questions. Then, of course, there were a few questions regarding the genetics, genes associated with Alzheimer's, the early onset and the late onset disease. And in the last year, there were a question each from essential tremor and Huntington disease. All these were pretty basic. If you cover the general aspects given in Harrison itself, you should be able to answer those questions. And of course, the element disorders, the thing which has been asked over and over again is the motor neuron disease. Last year, there were a question of limb girdle muscle dystrophy and myasthenia as well. And regarding stroke, thrombolysis and contraindication is a favorite question for both INI medicine as well as for NEET. You have to be thorough with the values, the glucose level cutoff, the blood pressure cutoff, the time duration, all these you should be thorough with. And regarding the various causes for intracerebral hemorrhage, 2 years back, there were a question regarding amyloid angiopathy and where does it cause bleed. Last year, there was a question, arteriovenous malformation, where would it cause bleed? Is it intraparenchymal, subdural, extradural, etc.? So those etiologies and its relation, you should be able to correlate. And of course, from the clinical point of view, they would ask you about a case scenario of paraplegia, and you'd be asked to identify the level of affection. And the thing highlighted in red is a thing which is frequently asked. The deep tendon reflex loss with extensor plantar. You have so many differential diagnoses, you will be asked to identify all except which is the answer. And of course, multiple sclerosis, the MRI has been asked, the McDonald criteria has been asked, the drugs has been asked. And last year, there was a question on reversible cerebral vasoconstriction as well. In such conditions, which is not so common in clinical practice, they usually don't go into much of a depth. You should be able to identify this clinical condition from the history and details provided. That is all they ask for when regarding the rare diseases, not only in neurology, in any other specialty. In rare conditions, you just need to make the diagnosis, that's all. So you just need to be acquainted with what are the cardinal features associated with those conditions. Rahul sir, over to you.
Yeah, Dr. Karthik, if you can please show the previous slide.
Yes, sir.
Yeah, so basically, I think Dr. Karthik has given a beautiful overview of the pattern of neurology questions that have been asked. I just have to add a few points. Number one, I want all of you to just focus on the screen and just look at these topics. Now, one look at this slide, it's almost the same list of important topics that you had while you were preparing for your NEET PG examination. So the point I want to tell you is, even for an exam like NEET SS, some areas are very, very important, like myasthenia, Alzheimer's, headache. So the areas that are important, they remain the same. So I have got a few suggestions for you. Number one, even if the topic appears apparently simple, for example, myasthenia gravis, it's a simple topic. But sometimes the rank deciding questions from topic like myasthenia gravis can be a factual question based on the autoantibodies in myasthenia gravis. So let me tell you that please don't neglect the factual information, especially the one given in Harrison. You know that autoantibodies in myasthenia gravis, it's an important topic. But you have to know, for example, that say MuSK myasthenia gravis, it is likely to respond to rituximab. It's given in Harrison. So that point is important. So even what percentage of generalized myasthenia gravis can have positive acetylcholine receptor antibody? What percentage of ocular myasthenia gravis will have a positive acetylcholine receptor antibody? I'm not saying that the majority of the paper will be based on these factual questions. Remember, you will have very simple NEET PG base level questions as well. You will have medium range questions as well. But the rank deciding questions often are these factual questions. And especially Dr. Karthik pointed out the importance of genetics. When you learn about Huntington's disease, you have to also learn about the Huntington's like diseases and the gene mutations associated with them, which is given in Harrison. So those little points can actually make the difference. See, a question that is clinical scenario based asked about subacute combined degeneration, well, anybody would answer that. But again, a factual question based on, say, for example, about the autoantibody that is associated with a multifocal motor neuropathy with conduction block. You will be able to answer only if you have gone through this and never miss out on the tables in Harrison. See, let me tell you, this is not just as a faculty of a platform. Remaining couple of months for NEET SS, I tell you, you have to watch the Allied test and discussion video, the Harrison's tables and flowchart videos, and the quick revision videos, because they cover a lot of ground. If you go through my Allied test and discussion videos, the last 3-year video recording is available in the app. It covers a lot of neurology. So I would suggest you to please go through that. Then a couple of more pointers that you should know is the question bank of DocTutorials, especially it is Harrison based, and I think you should definitely go through it. Try to solve as much as questions. In a day, whatever time you are spending for studies, 30% of your time should be for MCQ practice. Now, Karthik, I just want your opinion as well on the endocrinology part. What would you suggest at this time, focusing on the main videos or the QRP videos and the LI test and discussion videos that you have done?
So I think, sir, in this point of time, so based on the pattern of questions that have been asked in the previous years, whatever I have covered in the QRP plus the LI test series is more than enough to cover all the possible theory. Even one of the students had asked about in the group, in the chat box, about the sex differentiation. The sex differentiation is not asked, the DSD part is not asked in much depth in the NEET SS part. Whatever I have taught you in the QRP, just 5 or 6 slides I have taught in the QRP, that is more than enough to crack all the questions that can possibly come in the DSD section. Even for the adrenal, pituitary, thyroid, all the systems, I think just going through the QRP plus LI test series videos as well as Harrison, along with practicing the MCQs, will be more than enough for endocrine part.
Yeah. And one student had asked me, what about the initial chapters of Harrison? Are they important? Yes, they are important. Sometimes what can happen is you may get some simple, straightforward question, just like this question that you're seeing on screen on basic neurochemicals like substance P, pain pathway, and you may get basic neuroanatomy questions as well, just like some question on the molecular circuitry of the cerebellum, a question based on granule cells or basket cells. So you should expect such questions and they can be rank deciding as well. I think, Dr. Karthik, we can move to the next system.
Okay, sir.
Yeah.
So moving on to the next system, I have just kept gastroenterology as third because this is one specialty where consistently around 20 questions were asked in both the exams. So gastro was one specialty where a lot of image-based questions were there in the last couple of years. It is worthwhile for you to just, when you go through the corresponding part in Harrison, to see what are the images given alongside. And whenever you are a specific pattern is described in Harrison, you just try to, most likely it should be given by the either Rahul sir or the faculty who had taken that particular section along with the videos. But even otherwise, you can just browse through the net and get acquainted and familiarized. So, some of the students last time had made a mistake because last time there were so many questions like the alpha 1 antitrypsin, a small clinical history along with a liver biopsy specimen was given. And within that, there were PAS positive macrophages. But because they were not so familiar with the image part, if they had given it as a PAS positive macrophages or something, then they would have definitely clinched the diagnosis. Similar case with hepatitis B ground glassing. So they were not so familiar with the ground glassing. How does it appear like? But they would all be familiar with the description of ground glassing. So in all those funny descriptions, it is worthwhile just browsing through the internet to see how they actually look like in the specified pattern. So this onion skin appearance of sclerosing cholangitis, all these you know from the theory point of view, just that you have to be acquainted with the image part as well. This antral vascular ectasia, watermelon stomach is a well-renowned question. It's been asked again and again in the competitive exams. The granuloma of Crohn's disease, many a time this would be coupled with a clinical history. So that makes your life easier. Even if you are not that much familiar with the picture, you could at least exclude the other options with the help of history and other details given in the questions. And GIT is one area where physiology questions play a very, very important role, because in across the INI and NEET SS previous paper, this is one common question that has come. The secretory products and cells. There are so many named cells within the GIT. You have the G cells, the I cells, the K cells, L cells, epsilon cells, delta cells. So all these cells have a specific secretory product along with it. It is worthwhile making a table or a list of these cells along with the secretory product. As Rahul sir has already told you, this physiology and anatomy part, which could come from the initial pages of Harrison or the introductory pages of a specific section, could very well come in your exam. And the other important thing is the sites of absorption of vitamins and nutrients, from which part is the B12 absorbed, iron absorbed, calcium, folic acid. And it may come indirectly like that. If this part of the bubble is resected, which deficiency is more likely? So it could be asked indirectly as well. So that also is a very, very frequently asked question. Then if you go through the questions that have been asked from the liver, this liver injury and culprit drugs is a sure shot question. One question each was present in the 2022 and 2023 and most of the INI papers as well, which produces a hepatocellular pattern of damage, which produces a cholestatic pattern, notoriously by the antibiotic amoxicillin clavulanate. So all those questions were asked. And there were a few questions from alcoholic hepatitis. In fact, two questions had come in the 2022 paper regarding the management, whether to use steroids or not based on the discriminant score, as well as the Lilly model. Then the hepatocellular carcinoma is also a question they could ask. It is a unifocal or a multifocal hepatocellular carcinoma. The size could also be mentioned, and what would be the management strategy. They have also asked about the Milan criteria. And of course, there was an image of emphysematous cholecystitis in one of the previous exams, but you could guess that was an easier question. Then autoimmune hepatitis, then anti-mitochondrial antibody is also a very frequently asked question from the liver part. So in the viral hepatitis, I would say perhaps the most important part in the gastroenterology is the hepatitis B and C, and specifically hepatitis C. So many questions were asked from hepatitis C. You have to know in and out. So what is the timeline of diagnosis? What are the first line drugs? What are the alternative options? And very importantly, the extrahepatic manifestations of hepatitis C as well as B. All those cryoglobulinemia, the the lymphoplasmacytic lymphoma, so porphyria cutaneous tarda, all those association has been asked umpteen number of times. And vaccination schedule of hepatitis B and prophylaxis in immunosuppressed individuals has also been asked in the 2022 paper. And from the gut, the two important areas were celiac disease as well as short bowel syndrome. They were asked a couple of times each. And of course, the inflammatory bowel disease, I hope all of you will be acquainted with, because usually the questions were asked were of simple nature. You were able to crack this with easy difficulty. Sir, any point you have to make from the gastro paper, sir? Anything else that you find to be
couple of
important?
points. Number one, last time also we had good number of images, endoscopy images from gastro. So image-based questions in gastro, they are very important. I think Prashant sir has covered them in the QRP session as well. Please go through them because that can be rank deciding. That is number one. Number two, do not bother too much about the guidelines because you will have multiple guidelines for one disorder. So you have to just have a general overview of the treatment, and they might give you some scenario based questions wherein they might ask you the next step. So do not worry too much that regarding the guidelines part. They usually do not focus too much regarding the guidelines. That is what I want to tell you. Yeah, just these two suggestions.
Okay.
Yeah.
Okay. Now I have included a separate session called nutrition here, because this area, which is comes under the nutrition part in Harrison, I would say it is the highest yield. If you go through that limited area in Harrison, every year after year, there would be at least 2 or 3 questions from these part. I have put everything in red because if you go through the previous slides, I would be highlighting only a few points which I find as more important in the red. But when you look at this nutrition part, all of these have been asked again and again. So all these recommended daily elements of vitamin D, calcium, iron, you have to be acquainted with. Selenium deficiency, what are the features of selenium deficiency, selenium excess, the Keshan's cardiomyopathy, the Cashin-Beck's disease, the acrodermatitis enteropathica of zinc deficiency. What happens with vitamin E toxicity? Again, was a NEET question, 2023. Bleeding diathesis can occur, and vitamin E deficiency can occur, result in ataxia and hemolysis. That was a 2022 question. B6 toxicity causing peripheral neuropathy. Again, a previous NEET question. There were frequent questions regarding the total parenteral nutrition. What are the indications? What are the proposed content of each nutrient in the TPN? How do you monitor a patient on TPN? So all these are very, very important areas. And of course, the refeeding syndrome. There was a question each in the 2022 and 2023 papers regarding refeeding syndrome. The most common abnormality, the hypophosphatemia, the thiamine deficiency, etc. So this nutrition, you just cannot afford to miss. So these are the areas that you tend to overlook if you just go by specialty alone: cardio, neuro, nephro, gastro, ID. Likewise, if you go by specialty alone, you tend to miss out on these basic aspects like nutrition, basic physiology, and some certain other miscellaneous topics that I'm going to come on to later. Okay, so this is an extremely important area. Now moving on to hematology. Hematology questions.
So just one point to add there
Yes.
regarding nutrition. So for candidates preparing for NEET SS, so these questions from nutrition, you can answer at least most of them, not all. Most of them you can answer only if you have read it properly. But neurocardio, since you have at least most of you have cleared your MD or DNB recently, you will have at least some basic concepts. Maybe you have prepared for the theory exams. But this area, especially, you have to put time and effort. You will have to read it because definitely you will get questions from this. And secondly, I can see some questions in the comment section. Please keep them coming. We'll once finish all the systems and then we'll take the questions so that we'll not lose the flow, and so that you'll save your time as well. Yes, Karthik, you can move forward.
So hematology contributed a little less number of questions compared to other specialties. But again, from here also you can expect around 10 to 12 or 13 questions from hematology. So hematology, the bulk of the questions had come from two areas: RBC disorders and leukemia lymphoma. So of these, AML prognostication and treatment had been asked the most number of times across all recent medicine exams. Then comes the Hodgkin's lymphoma. So which are the drugs that can be used, that cannot be used? That CD30 monoclonal antibody has also been asked for a recent exam. And CLL. So Rai staging was asked in the 2022 paper. An image of smudge cell was asked in the 2023 exam. Then, of course, the CML genetics and all was straightforward. The Philadelphia chromosome and all were straightforward questions. And the Duvalier scoring, which we use for the assessment, follow-up assessment of lymphoma, was also asked. Then in the RBC disorders, the most important question would come from that table in Harrison, which describes the various differential diagnosis of hypochromic microcytic anemia. So of these 4 DDs that you have, the iron deficiency, chronic disease, sideroblastic, and thalassemia, the question would contain the serum ferritin levels, the total iron binding capacity, and serum iron, all these things will be given, and you will be asked to identify which is the actual diagnosis the patient is suffering from. So this is a very common question. And second area is the drugs causing hemolysis in G6PD deficiency. Then, of course, there were questions. There was one question 2 years back where a patient with polycythemia vera had come with like abdominal pain and ascites and jaundice. It was actually Budd-Chiari syndrome. So Budd-Chiari syndrome that had missed out in the gastro part. So Budd-Chiari is also an important area, and it had come asked in the background of polycythemia vera in the last exam. Then, regarding the multiple myeloma and related disorders, the most frequently asked question was regarding the treatment regimen, which are the drugs that were used, about the lenalidomide, bortezomib, and the individual toxicities, all those varicella zoster, the deep vein thrombosis risk, all these were asked multiple times previously. And regarding the beta 2 microglobulin that we use, so all the amyloidosis, the questions on amyloid, myeloma prognosis, all were basically in the NEET PG level, whereas the questions were slightly more difficult when it came from the treatment part of myeloma. And 2 years back, there was a question regarding the cells seen, the Mott cells, the Russell bodies, all these were asked as an image-based question in one of the NEET papers. So among some of the miscellaneous disorders, methemoglobinemia was used. A easy clinical scenario to identify methemoglobinemia. And of course, von Willebrand disease, a very high yield area. There was one question regarding an acquired von Willebrand disease. So you should know which are the conditions that can result in an acquired von Willebrand disease. And also, there were clinical scenarios where a bleeding diathesis was given, and you were asked to identify whether it was von Willebrand or was Bernard Solier or it was Glanzmann thrombasthenia based on the results of the platelet aggregation studies. So those are very important areas, how to identify each condition based on the platelet aggregation profile. And hematology is other area where you can expect a few images. And the previous images have come from the cutaneous T-cell lymphoma and hemoglobin electrophoresis. Very, very important. All those hemoglobinopathies you would be asked to identify based on the electrophoretic pattern that is given, which is also described well in the QRP by Dr. Shinto sir. And there were peripheral smear images showing the OR roads, the Reed-Steenberg cells, the faggot cells of the AML, smudge cell of CLL, flower cell of adult T-cell leukemia, and of course the raccooni that you see with amyloidosis. So all these are previous questions. We are just not beating around the bush. These are high yield areas where questions are being repeatedly asked from. So keep in mind, you cannot afford to miss out on these areas while revising. Sir, any point that you have to make from the
So,
hematology?
just a couple of points. I think you should also go through the blood banking part. Blood banking, blood grouping, you may get questions. It has not been asked in the previous year, but I
I
think
think that there was one question, sir, in the blood grouping last year.
yeah,
Last year, there
blood
was one.
banking, yeah, blood banking is very important. So please go through it. I think it's a high yield topic. Number two, hematological malignancies, as Dr. Karthik said, very, very important. Please go through it thoroughly. And also disorders like von Willebrand's disease, very, very important again. Just one more update. We are recording some new videos for RBC disorders by Shinto sir. And I think in the next couple of weeks, it should be up in the app as well on the RBC disorders. Okay, so that is what I just want to update you on. Yeah, yes, Karthik, please go on.
So regarding cardiology, I think the cardiology discussion should start with ECGs because you can expect 2 or 3 ECGs in every paper. Usually the ECGs would come from AV blocks. AV blocks has been the single most important area where you would frequently get ECGs from. It could be the second degree block, the 2:1 Venke back, or a complete heart block, or even a first degree heart block has been asked. Then pre-excitation syndrome, the Wolff-Parkinson White syndrome, the atrial fibrillation and flutter, torsa de pointe, and one of the previous INI papers had shown an ECG showing torsa de pointe, and they had asked about the drug that can result in this ECG picture. So such indirect questions, or they would give you some like a clinical scenario, like a patient taking erythromycin, which has resulted in like QT prolongation, which would be the drug responsible like that. And also the electrolyte disorder and ECG findings, hypercalcemia causing QT shortening, hyperkalemia causing the sine wave pattern, all these resulting in QT interval prolongation and shortening, all these permutation and combination that you need to know. And one of the previous papers, I think back in 2020 or something, they had asked about the Romanov-Watt syndrome and the Jervell-Lang-Nielsen, where the long QT syndrome, the ECG was given along with the history of deafness. So such questions you can also expect. Okay. And regarding valve disorders, surprisingly, there were a unexpectedly and high number of questions were asked regarding the tricuspid valve disorders last year. There were 2 questions about tricuspid stenosis, 1 question about tricuspid regurgitation with regards to the carcinoid syndrome. So 3 questions from the tricuspid disorders last year, and 3 questions from the aortic and mitral disorders uh, in the 2022 paper. The questions were regarding the etiologies of aortic root dilatation. Then there was a question regarding which is an indicator of the severity of aortic stenosis, like that, and the management of mitral stenosis across various scenarios. When the valve is calcified, what will you do? When the valve is non-calcified, when the patient has a large atrium, a left atrium, what will you do? So all these clinical scenarios they may ask with regarding the valve disorders. And regarding the disorders of vasculature, the questions on pulmonary embolism and coarctation are usually straightforward and simple, but they could ask difficult questions regarding the heparin-induced thrombocytopenia. In one of the papers, the culprit antibody was asked, and one of the questions, which is the ideal drug that has anticoagulant that has to be used in heparin-induced thrombocytopenia in patients at high risk of catheter-induced thrombosis. In such situation, fondaparinux cannot be used. You have to go with bivalirudin. So such situations with small nuances can also come. And this is the point that I've highlighted earlier regarding cardiomyopathy. The most anticipated question would be regarding hypertrophic cardiomyopathy, which is perhaps the single most important area in the cardiomyopathy part. But surprisingly, 2 questions on cardiac sarcoidosis came last time, but they were all straight one-liners from the Harrison itself. So the students who have gone through the sarcoidosis part previously would have easily answered that. But again, if you had not read that, it would have been very difficult to answer, because all those one-liner true or false statements would be difficult to eliminate if you had not read that previously. And the indications of ICD and HCM, all these are very, very important areas. And you cannot go beyond, or you just cannot overlook the importance of the basic clinical cardiology, the JVP. What are the waves? What are the conditions that can cause abnormality in the JVP? There is a free video available in the DocTutorials app by Kamal sir. So please go through that and be thorough with the basic abnormalities, the waves in the JVP, as well as the conditions that can cause an abnormality. And a clinical scenario where when should we stop antiplatelet, how many days prior to surgery or a procedure is one scenario that you can usually get. There is a beautiful table given in the Harrison, as well as get from some cardiology journals regarding when you have to stop those medication prior to surgery. And regarding the drugs, we have to be thorough with that table of anti-arrhythmic drugs. Which class do they belong? Which channel do they block? And which are the specific arrhythmias which they are useful for? So these points you have to know, along with the newer anticoagulant drugs, mostly the mechanism as well as their antidotes are being asked. And last but not the least, the complications of myocardial infarction, the late complications like the papillary muscle rupture, the ventricular septal rupture, everything can be asked, as well as infective endocarditis. There has been a lot of questions regarding which of the following is not a major criteria. There has been a revision in Duke's criteria as well. So please go through that. Kamal Sara has recently posted that in our cardiology group. So any point
Yeah.
should be
So
added, sir?
can you just show the cardiology slide once? Okay. I think one point to be added in the basics, I think heart sounds also.
Yeah.
I think they've asked before, I think in one paper, there were 2 questions on heart sounds, and these are actually basic level questions. That's why I always say that even in NEET SS paper, you can expect some simple basic questions. And sometimes we tend to overlook them because, we think that we know them, but just once go through them. So please go through the heart sounds. And secondly, on the dynamic auscultation of cardiac murmurs, you may get some questions like all are true regarding, such murmur except, and you might get questions on the preload, afterload variations. So please go through them. Very, very important. Next, I think already Dr. Karthik has suggested about the importance of the topic cardiomyopathy. I think a lot of factual questions can be asked, not just scenario based. So you please go through them. Cardiomyopathy, and not just dilated hypertrophic. You can expect questions from arrhythmogenic right ventricular cardiomyopathy, maybe some gene mutations like tafacin gene mutation they can ask you. So not to be neglected, please go through cardiomyopathy is very, very important. See, these are some factual questions that can actually make a difference. And again, the basic pulse tracings, again, very important, and their associated conditions, again, has been asked previously in NEET SS as well. And I think I would also suggest you to go through one video by Kamal Sharma sir, where he has discussed the images in cardiology. And I think you may get some questions, not just ECGs, you may get maybe some tracings like dip and plateau sign in case of constrictive pericarditis. So such sort of images also you can get. So please go through them. Rest everything, I think Karthik has beautifully summarized. Yeah, please go on.
So I think ID, it occupies a so much vast volume in the Harrison paper. But one thing about ID questions which has come in NEET SS as well as INA SS is that all those were one-liners, were straight picks from Harrison. So all the questions from hematology and all the questions from infectious disease were straight picks from Harrison in whichever exam you will go through. So whereas if you go through cardiology, endocrinology, neurology, you may have certain controversial questions that could not be straight, it could not be straight away. You cannot find it from Harrison. So, but all the questions from the last 2 years, NEET SS papers from ID were straight picked from Harrison. It's very difficult to say which is important because almost even the conditions that you feel are little less important were asked previously. So I think even if you don't go into that much detail, you have to identify, suppose one infection, when you go through that infection disease part in the Harrison, try to identify the keywords or any characteristic abnormalities given in Harrison. So just learn that instead of learning that A to Z. So the questions that were asked more than once was KERP 65 score, the Lyme disease, the Whipple's disease clinical scenario, along with the treatment that has to be used, and leptospirosis. And of course, there were questions on botulism, listeria, Pontiac fever, donovanosis, etc. But the thing is, they have not asked into that much of depth. So if you want to know about donovanosis, it was a case of genital ulcer, and they have described the clinical features as well, whether it was ulcerated, painful, lymphadenopathy was there or not, like that. So all those simple superficial aspects that you may have learned for NEET PG, such level questions could come for your SS exam also. And from the fungal part, cryptococcal meningitis was the one which was asked most number of times, both in isolation as well as a part of opportunistic infection in a patient with HIV. Then, of course, you cannot uh, give less importance to HIV, and the most important area would be a patient with HIV background. They would give other clinical features to make you identify which opportunistic infection the patient is suffering from. So previously, they have asked about the progressive multifocal leukoencephalopathy, where the patient had presented with an HIV patient with dementia, and then you had questions about Bartonella infection as well. So all those opportunistic infections in HIV, how to identify them based on the clinical patterns and the hallmark features you should know. And of course, the immune reconstitution syndrome. Regarding the viral diseases, the CME infection and the post-transplant infections, very, very important table in Harrison. It is given, it is summarized at the early period, what are the infections, in the late period, what are those infections. Based on that timeline given in Harrison, you should be thorough with the culprits of post-transplant infection. Then the malaria, the picture-based question on how to identify the malarial parasite as well as the management of malaria, especially in pregnancy. Malarial management in pregnancy is a frequently asked question, very, very important. And the question on larva currents was also there in the paper 2 years prior. And Moving on to rheumatology. Rheumatology, 70 to 75 percentage, 3 out of 4 questions from rheumatology would be from either of these three areas: rheumatoid arthritis, SLE, APLA, or spondyloarthropathies. You have to know in and out of these three areas. All the remaining questions, they usually don't ask into that much depth. The fourth most important area in rheumatology, based on the previous papers, was vasculitis. Even in the case of vasculitis, they have not asked into the individual attributes of the vasculitis. They had presented a case scenario. They wanted to identify the diagnosis from that case scenario which is given, or instead of asking the diagnosis, they would ask you what is the treatment. For example, an elderly man presented with sudden onset visual loss. What is the first line treatment? So you have to assume it is a giant cell arteritis, and oral steroids, high dose steroids would be the treatment of choice. So such questions, or a patient with oral and genital ulcers, and which of the following is not seen? So indirectly, it is given as Behçet's disease, and you have to answer accordingly. So even inflammatory myopathy also, usually they won't go into that much depth, but you should know about the culprit antibodies, their specific associations, which is the one which is associated with malignancy, which is the one which has strongest autoimmune association, all these things, as well as the involvement patterns, you have to know. And dermatomyositis has been asked as an image-based question as well. The Schall sign and the Gottron papules have also been asked 2 years prior. And IgG4 related disease also you should take note of. Some of the named disease like the Kuttner's tumor, the IgG4 related pituitary disease, autoimmune pancreatitis, etc. Rahul sir, any point you have to make from the rheumatology side?
So I think, it's important to, go through the antibodies, especially number one, because you may get questions like, say, if the patient with systemic sclerosis has an anti-RNA polymerase 3, then there is higher risk of involvement of, it is kidney, renal involvement is more. So such factual questions based on autoantibodies in various rheumatological conditions can be rank deciding. For example, if you look at Harrison, the autoantibodies in SLE, you might get a question on anti-C1q. So those antibodies, very important, number one. Number two, the immunofluorescence patterns. You may get some sort of a scenario-based question wherein you may get the image of an immunofluorescence pattern as well. So that also you have to know. Second, next about the genetics of some conditions. For example, if you go through inflammatory myopathy, they can ask you questions based on that, and also the histology of these conditions, dermatomyositis, one image-based question on perifascicular atrophy, because that is given in Harrison. So at least those images, just once go through it, I think you can expect questions. And then I think the topic of vasculitis is very, very important. You have to know, they can ask you, I think one of the NEET SS exam, I've seen a question being asked on the duplex finding in case of giant cell arteritis. So the halo sign, I think that question also has been asked. So I think rheumatology, the good thing about rheumatology is if you go through that rheumatology part, it is almost sure that you're going to get it right, provided you have read it well. But cardiology and neurology, that, they can twist the question as well. So the strike rate for rheumatology is on the higher side. So I think you have to focus on it. So that is what I want to tell you. I think just one more point I wanted to add. Yeah, about the biologicals. So please go through the biologicals and the mechanism of action. That again can be asked. Drugs in rheumatoid arthritis, psoriatic arthritis. So please go through these monoclonal antibodies as well. And that's it. That's what I want to tell you. And you might get simple questions as well, scenario-based question on reactive arthritis. Okay, so that's it. And also one more thing, in one of the NEET SS question papers, I've seen a question asking the difference, the radiological difference of the spine affection in case of reactive arthritis versus ankylosing spondylitis. The marginal syndesmophytes are more seen with ankylosing spondylitis, whereas reactive, it is mostly non-marginal. So that question has been asked a few years back in NEET SS as well. Yes, Karthik, that's it.
So regarding nephrology, one question that we consistently associate with all the NEET SS papers is one regarding renal channelopathy. You can have question on a Barter, Gittelman, Little, like apparent mineralocorticoid excess, Gordon syndrome, etc. So I recently had posted one table in one of the groups summarizing all these renal channelopathies. That is a sure short question in most of the papers. Okay, you have to be thorough. How to differentiate between Barter and Gittelman, and which one presents with hypertension, whether it is an activating mutation, inactivating mutation, what is the location of the channel, all these things that you have to be thorough with. Then, of course, there could be like which are the following is not seen with pre-renal, or which is a feature of renal AKI. Such questions could be there. And there were two questions, one from INI and NEET SS regarding the staging of AKI. The Akin staging, they would give you a creatinine and the urine output and would ask which stage of the AKI do they belong to. And very, very important, and I've just summarized it in one sentence, but it is extremely important. You have to make a list of all these glomerulo nephritis, the different things, the post-streptococcal, the post-infective, the membranous, the membranoproliferative, the diffuse proliferative, FSGS. So all these things, what are the characteristic features? How would you identify it in light microscopy, electron microscopy, and immunofluorescence? Where are the location of the deposits? Any secondary causes for each? So you may very well get a clinical question asking, giving these details, and they would ask regarding which is the likely etiology. Or they would ask, give a setting for a secondary membranous nephropathy, and they would ask where is the deposits most likely to occur. You have to answer it as subepithelial. So, like some twisted question you can expect regarding glomerulonephritis. There were questions from IgA nephropathy as well as thin basement membrane disease in the previous papers. Then, of course, renal tubular acidosis. The questions can be really hard from RTA, but fortunately, for the last few years, all the questions were pretty straightforward, like which has hypercalciuria, which has hyperkalemia, like that, where you will see renal stones. So all those simple questions would have been coming so far in the recent papers regarding renal tubular acidosis. Then, of course, polycystic kidney disease, both the forms you have to know, the genetics behind each of them, then what are the radiological characteristics, which are the drugs used, what are the complications and associations with polycystic kidney disease. All these are subject to questions. The very important questions are dialysable toxins, which are dialysable, which are non-dialysable. You have to make a list of it and learn it thoroughly. Then, of course, the hemodialysis, the complications, then certain values, the normal, the GFR, the renal blood flow rate, and a number of nephrons. All these are basic value-based questions which could also be asked in nephrology. Rahul sir, any comments?
Uh, just a few points to be added. Number one, it is also important to go through the basic topics like approach to proteinuria, approach to hematuria. Because I've seen in one NEET SS exam, they have asked a question based on the urinary protein assessment, where they have asked, in one statement it was there, which are the proteins that you can see in the urine of a normal person. So that is actually given TAM horsefall protein, urokinase, beta-2 microglobulin, so albumin. So that is there in Harrison, approach to proteinuria, approach to hematuria. That is one area that you have to know. And also the basic points like, say, dipstick test only detects albumin. To detect total protein, you have to go for sulfosalicylic acid test. So those points you will get from those basic chapters. And then another point is about novel biomarkers in acute kidney injury. Again, highly probable question that has been asked previously as well. Novel biomarkers in acute kidney injury. Then you may get some factual questions based on the nephrotoxins. Like they might ask you a question on the sequence of renal impairment in case of contrast-induced nephropathy. When does the creatinine begin to rise? When does it peak? When does it come back to normal? Again, direct lines in case of Harrison. Because last time they had picked a few questions from nephrology directly from Harrison, especially on the leptospira nephropathy electrolyte abnormality associated with it was asked. And also the glomerular disorders. If you go through the primary glomerular disorders, you can see that there are certain tables in Harrison showing the conditions associated with them. So that you can expect as question. Heroin is associated with which glomerular disorder? which glomerular disorder is associated with anti-phospholipase A2 receptor antibodies. So they are again rank deciding topics. So please go through them. And then regarding again, the manifestation of chronic kidney disease, especially mineral bone disease. Again, very important. You may get some basic questions from that. So that is it. I think rest of this has been covered. And Karthik, I thought I'll take the questions towards the end, but there is one comment which, I have to pick it up. Somebody says you are looking so handsome without the mustache. So I thought, I'll just, let you know that there is a comment in the chat box. Okay, Karthik, you can continue.
Okay. So then respiratory medicine, I think the questions have been few from respiratory medicine part in the last couple of years. And they were mainly related to the pneumothorax, the ARDS criteria, and when will you do we need to give steroids, and about the cutoffs of the P by F ratio and all. Then of course regarding the diagnosis of tuberculosis, there has been a true false question regarding the ABPA and the interstitial lung disease pattern, the honeycombing pattern, the UIP pattern. There was a true false question regarding that, and the newer drugs in bronchial asthma. So these were the few questions which I could pick up from the respiratory medicine part. And of course, the lung infiltrates with eosinophilia was again a previous NEET SS question. Probably when I wrote the exam, there was one question like that. So mostly, I think all these points would comprise of the entire respiratory part, I think.
Yeah,
Then
and
fine. Yeah.
Just to add on, it's very important. Yeah, I think Karthik, next slide is already there. I think tuberculosis, you are already covering the next slide, right? Please go on. Please go on. Please go on. Yeah.
No, sir, the TB diagnosis I have included in this slide,
Okay.
sir.
Okay. So I just want to tell you that the newer regimens for TB, I think, again, very important. It is also good to just have a superficial read at the recent program changes as well. Just like the newer regimens, you may get a question based on that. So that again is important. And maybe some questions like, I think it was a few years back, there was one question on the Heimlich valve for pneumothorax. So that was asked as a question. Rest, I think, though pulmonology is there as a separate group, I know many of you would be asking me, sir, should we spend time and effort for pulmo? See, what I would suggest to you is it is better that you go through it as well, because you can definitely get questions, and National Board is very well known to throw in surprises. Please go through them, especially the topics that Karthik has suggested. And also, you have to know about acid-base balance. I'm sure since you all have done your MD and DNB, you know the basics of acid-base balance. So you can expect scenario-based questions based on acid-base balance as well. Bronchial asthma, recent guidelines, again, you have to know. Interstitial lung disease, again, you might get image-based questions, maybe a ground glass appearance sort of a CT might be given, and you might be given options like UIP, NSIP, and they might ask you what condition is this. And again, about some drugs like nintedanib, the question can come. And the remaining topics, I think, all are expected topic areas, and you can just go through it. And again, let me tell you, I want all of you to be active in the target NEET SS group. Even last year, I think almost the majority students who were seriously preparing for the NEET SS were there in the target NEET SS group, were giving the exams as well. And even last year as well, after the exam, many students told me this, that, sir, we were watching, lengthy lectures or, reading. But eventually what helped us the most were the crisper, quick revision videos, LI test and discussion videos, Harrison's tables and flowchart. I am saying this at this point of time because time is limited. You will have to prioritize your resources. You will have to see which resource can give you maximum output in a short span of time. Please binge watch. Somebody asked me in the comment section, is LI test and discussion video of this current season enough? Please understand, every year we have put new questions. Karthik also has put new questions every year. I have put new questions. Everyone has put new questions, which means if you go through those videos of last few years, A whole lot of topics of each system would be covered, and that too in an MCQ oriented manner. Because somebody was saying that I've just recently done with my MD, do not have much time. What should I do? I think LI test and discussion, please binge watch them and then retrospectively go back to Harrison is what I want to tell. Karthik, please go on.
So I think I would cap it off with this slide of miscellaneous topics. After every exam,
Just one query, I think a quick query I'll take. A renal transplant, we have not seen much questions being asked, but again, you can just, go through it, at least the table that is given in, Harrison on the transplant infections and the rejection. I think basic points, just go through it. Yeah.
so after almost every exam, I get feedback from the students that the questions were from unexpected areas. We have asked questions from the high altitude pulmonary edema, snake bite, OP poisoning. But you have to understand that these are not unexpected areas, and these are questions where you have to expect at least one or two questions from these areas. High altitude pulmonary edema, you have to know what are the precautions to prevent it, what are the drugs useful, and what is the acute management. And about heat stroke and frostbite, what are the principles in management? What should be the sequence that you have to follow in treatment? All these are beautifully mentioned in Harrison. Then regarding snake bite, of course, the toxicity of each snake and what are the features associated with each and the management. The most commonly asked one is the neurotoxic bite and how would you manage or prioritize the management. Then of course the antidote for scorpion bite, then OP poisoning, shellfish poisoning. All these are questions that have been asked multiple times, and of course some of the sleep disorders as well, which comes under the neurology and psychiatric overlap. The narcolepsy and all has also been asked. So, Rahul sir, any other addition that you want to put into the miscellaneous group?
Just want to add that, topics like high altitude pulmonary edema, heat stroke, they have been covered by Mithun sir in the videos. Please go through them. And we are coming up with some revision videos also for that. So please stay tuned. A few subjects, we are adding new revision videos as well. So that also, it will be up in the app very soon. Newly recorded. I think, Karthik, you have done a new recording based on recent updates as well for
Yes, sir.
endocrinology.
Yes, sir. Yes, sir.
So I think that also in a couple of days' time, this will be up in the app as well. So that is what I want to tell you. And again, those who are not yet in the target NEET SS group can inbox me in Instagram. My Instagram ID is dr_Rahul_Rajeev. I'll be sending you the link of that NEET SS. And I would also request, those who are watching this session, if you can just share this with your friends group as well, your batch group, so that they also know about what are the high yield topics, because I know that there are a lot of students who have just done with the MD and DNB exams. They're looking out for what are the high yield topics. I think if you can share with your friends, it will be highly useful. Yeah, thank you. Right.
And sir, do you remember, sir, the last year after the NEET SS, we had done a analysis video on the day after the exam,
Yeah.
and the students were asking how many questions were actually there from Harrison, and we had arbitrarily answered that around 90 questions were straight picked from Harrison. And in the last few days, I had made it a point to actually count the number of questions that were actually straight one-liners from Harrison. It was actually 104. Out of the 150 questions, 104 questions were straight one lines from the Harrison. Another 20 questions, you could get the answer if you had read Harrison by excluding other options. And another 20 questions, it was out of Harrison. Like you may be able to exclude two options, but they were not straight picks from Harrison. So just to know, you would be able to answer more than 100 if you had read Harrison thoroughly, just to make a point.
And again, this is, I think, very important for the students who have just done with their MD or DNB. I get so many messages. We are just done with the exam. Do we stand a chance? I still would say, since you have prepared for your theory exams, you have got that advantage. Please go through the Q bank then. Suppose you have got no time to go through the videos. Go through the Q bank, keep Harrison open, and then retrospectively come to Harrison. That is what I would say. See, what Dr. Karthik is also trying to tell you is, it's all about probability. What another person is likely to get it right, you have to get it right. That's why Harrison-based topics are again important. Right. Right.
Okay, sir. And this is the usual
One quick
pattern.
query from Poonam. What should be the target for the number of questions correct in the DocTutorials DT? See, it varies, depends on the difficulty level, but always try to be in the top 20%. How many students are giving the exam? Try to score a rank that is in the top 20% at least, because most of the students who are seriously preparing do give the grand test. And again, I want to tell the listeners, even if you're starting your preparation, please give a grand test. At least have a self-realization where you stand. There is no point hiding your weaknesses. I don't want the NEET SS exam to be the first set of full questions of 150 that you're giving. Please practice enough grand tests before you go to the actual exam. Yeah, please carry on.
Yeah. Regarding the difficulty level of the questions, no matter how simple like the paper may feel when you're going through the questions, 25 to 30 questions will be difficult, and that may appear simple, but they will usually set it in such a pattern. So even if when you are going through the exam, unfortunately, you may get all the tough questions first. So don't get disheartened while you are going through the exam. Always take one question at a time. Don't keep the baggage of the previous questions that you were not able to answer while answering that question, because you may have had all your tough questions before that. Now you may be going to have a flurry of easy and moderate difficulty questions. So it is very important to have a clear head while answering that question. Very important to focus and identify the keywords, read the question twice, and don't make silly mistakes. That should be the single most important message that I want to give out to you.
Yeah. So I think, Karthik, are we done with the slides?
Yes, sir. Yes, sir.
Yeah. So I think we can stop the screen sharing. Meanwhile, if you have got any queries, we'll take the questions. So before we take any queries, I just want to tell the viewers as well. I think a beautifully prepared presentation by Dr. Karthik. You can imagine the sort of effort that he has taken. The entire slides were prepared by Dr. Karthik, because it is difficult to go through the question papers, to segregate it into systems, and you watch this video, because when you write the exam or when you are close to the exam, once you go through this PDF, we'll be sharing the PDF in the target NEET SS group of DocTutorials, and it will actually help you a lot. At least you can focus on, okay, I have to put maximum focus on these topics. So thanks a lot, Karthik. You have always been a hardworking person, and wonderfully prepared slide set as well. And I think we'll take some quick queries. First query, Ajay Jain, what about biostatistics? In the DocTutorials app, there is a video by Dr. Rajasi Madam that has been, she's a PSM faculty for NEET PG, but she has made an exclusive video for biostatistics for NEET SS and INSS. Please go through them, number one. Number two, what about oncology? See, again, oncology, there is a separate group. But if you look at the prospectus of NEET SS, they have put it in such a way that even if there is a question from oncology, you still have to take it, because they have just said questions will be from medicine. That's it. They have not said, only from these systems in medicine, the question will come. So at least the important hematological malignancies, you have to be very thorough. The solid malignancies, the common ones, at least superficially, you have to know. That is what I want to tell you. And then question on critical care. I think you will have to go through the videos by the videos by Mithun sir. I think he's doing a small revision video as well. I think it's worth to go through that. And Dr. Karthik, can you see if there are any other questions?
Sir, about psychiatry, one of the students have asked.
Yeah. What I'll do is I'll try to schedule a session by our psychiatry faculty for NEET PG. We'll try to do a small session if you all want it. If you feel that, you want a session for psychiatry, some crisp session for psychiatry, we'll try to give for the DocTutorial students. I'll be trying. Okay. So Neeraj,
The genetics part also, sir.
yeah,
Genetics part
genetics, there is already a QRP recording has been done by Dr. Roshan Daniel, who has done DM genetics and from PGI. So he has already done the recording. After editing, that will be uploaded. So there will be a video on genetics. Again, a crisp video, a concise, crisp video on genetics will be there. And then the next point is, so psychiatry I've just said, biostatics I've just said, oncology I've said, Dermatology, I think Dr. Vishnu has, is already planning a session. So, he is planning a small revision video for dermatology. Okay. No doubt, Karthik is actually super awesome. Somebody is also a big fan of you, Karthik, in the comment section. I am also a big fan of Karthik, no doubt about it. Okay, so next is, we'll just see any other query. Karthik, any suggestions? How many questions? If somebody is targeting for top, say, 100 rank, I think, in the grand test, you should try to clock above at least 110. You should clock above 110 is what I feel. Above 110 correct answers on a, difficult GT, not a very easy GT. Okay, 120 plus, 125 plus, again, good. That's what I would say. Karthik?
In the last previous two sessions also, those who had scored around 115 to 120 correct, irrespective of the negatives, have scored less than 100 ranks, around 115, 115 correct.
Yeah, yeah. And then should we go through the QRP videos first before revising main notes? So I would suggest that it depends on the time that you have got in hand, because the time is less. So you have to prioritize. It depends on where you're standing right now. Depending on that, please adjust your study strategy accordingly. If you feel that you are so weak in one particular topic, then go through the main videos. And then again, I have seen a few comments that somebody is from a pediatric background, somebody is from pathology background. Can they do it? I just want to quickly tell something. There is one of my students who's from a pediatric background. Her name is Dr. Aishwarya. So she had prepared with DocTutorials, Karthik, if you remember. So she actually was from a pediatric background, wrote every exam. Beginning, she was not doing well, but for NEET SS, she got rank 3. And then she's currently doing DM Neurology from GMC Calicut, Kerala. And now there is a Torrent Young Scholar Award. And I just saw that, she was in the South Zone. She has been selected for the finals with second position. So it's happy to see all this. So it's all about the effort that you put in. Nobody is going to finish the entire syllabus. But with the remaining under 2 months that you have got, why not put in your best effort? Each day that you have got, make it count. You cannot simply say that the portions are vast, I'm not remembering. Yes, the portions are vast, no doubt about it. Everybody would be nervous giving an exam. Even I was nervous giving the exam for DM Neurology, even after having learned neurology for 3 years, because nobody will be able to complete. So that is what, but at least this is a competition where you are competing among yourself. Make each day count. That is what I want to tell all of you. Okay. Right. Karthik, any other questions that you are seeing that should be answered? So Sudarshan, can you please let us know the list of new recordings that are planned in the QRP? Definitely. As and when the QRP videos are updated, we let you know what are the new videos being updated, because some of them will be old videos only, but some of them we are putting new videos as well. Okay. So from now on, I think every 2 weeks you have to, bare minimum from now on, every 2 weeks you have to give a GT. Bare minimum. Okay, right. So Sujay is asking, kindly make a session for NEET SS pediatric group. We'll definitely consider that comment. And will there be sections? Suman, for your question, will there be sections A, B, C, D for NEET SS as per previous notice? Because we never know. With the national board, you can expect many surprises. Okay, so we never know. Okay, like latest guidelines, see whatever is necessary for latest guidelines, we'll be discussing in the target NEET SS group. Any recent, changes, because for next 2 months, we'll keep the group very active as well. Okay. And yeah. So any questions? Prepare for psychiatry, genetics, onco, renal transplant. Karthik, are you seeing any other questions? Yeah, there is one question. 2023 neurology recall video. Yes, we'll be uploading that. Do not worry about that. 2022 is there. 2023 neurology is yet to be uploaded. And there is one more thing I want to tell you. In the DocTutorials app, in the QBank part, at the lower section, there are MCQs on biostatistics, and there are MCQs on the previous year questions. So NEET SS 2023, all the 150 question recalls, they are there. The questions are there. NEET SS 2022, Again, the questions are there. So if you just want to quickly go through the questions as well, you can go through it. Okay. So
Sir, and
Karthik, I think,
immunology
yeah.
also, sir. Immunology, I think Dr. Vishnu is covering it in the QRP,
Yeah,
right?
Dr. Vishnu is covering. I think in the QRP session, I think he is covering. Shashank is asking how many factual. Shashank, it is very difficult to predict. I have seen fluctuations. I have seen papers where it was very factual. I've seen papers where even there were questions on vascular imaging in neurology. I've seen questions like that. So it's all about probability. With the time that you have in hand, aim for progress, not perfection. According to your capability, with the time that you have in hand, make every day count. That is what I want to tell you as a friend, as a senior. That's what I want to tell you. I think, can we call it a day, Karthik? We have
So,
almost.
sir, and as sir told, we will be trying to be more active in the group as well. So, I would request the students also to participate more, to answer more to our polls. And you can personally, like if you want to make any summary table, which I've been posting in the group, you can definitely ask me if you want any summaries for the same, so that will be helpful also for your last minute revision.
Okay, okay, right. So thank you everyone for joining, and you can share this with your friends as well, preparing for the NEET SS medical group, so that they also will be benefited. And we, love to hear from you as well after the NEET SS results as well, on how the app actually helped you in your preparation as well. Thank you so much everyone for joining. Thank you, Karthik, and thank you so much everyone. Bye bye everyone. Keep studying well. Make every day count. All the best everyone. Thank you.